Hi, I am presenting a case of hysteroscopic polypectomy. We had a multiparous woman with history of medical termination of pregnancy done 1 month back and complained of abnormal uterine bleeding. Transvaginal sonography showed an hyperechoic mass in the cervical canal. Uterine cavity was empty and it was suggestive of a polyp that is prolapsing out of the cervical canal. But on examination, cervix was not showing any polyp. We planned for a hysteroscopic polypectomy. We began with the diagnostic hysteroscopy by vaginoscopic method, where we just introduced the telescope into the diagnostic sheath into the vagina and close the introitus, and slowly we try to identify the mass inside the vagina and then entering into the cervical canal. There we can see some polypid mass in the cervical canal. It is filling the whole of the cervical canal, and we were trying to identify the cervical canal to get entry into the uterine cavity to find where is the stalk from where the mass is arising. And slowly we could negotiate. We had a place in the posterior aspect. Anteriorly, we were not able to negotiate into the uterine cavity. Slowly, we negotiated in the posterior aspect. So that's where we could see the cervical canal, and slowly we get entry into the uterine cavity. The first we saw the left tubal ostia, just to confirm that we are in the uterine cavity, and the other side tubal ostia. And we are seeing that uterine cavity is empty on the fundus and the posterior wall is clean, and there appears a stalk just inside the internal os. The polyp arising in the endometrial cavity with the stalk on the anterior wall of the uterus, and it is prolapsing into the cervical canal, filling the whole of the cervical canal, but it is not come out of the external os. It is just inside the cervical canal. Considering the history of MTP 1 month back, we thought it could be retained products of conception, but urine pregnancy test was negative, and ultrasonography also confirmed that this hyperechoic mass is arising in the cervical canal with the empty uterine cavity, which was again confirmed by diagnostic hysteroscopy. Then we passed the operative sheath with a scissor, were test trying to confirm the site of the pedicle. So as we slowly negotiate into the uterine cavity and trying to find out the origin of the pedicle and try to divide the pedicle close to the uterine wall to prevent its recurrence. She had a significant amount of bleeding since past 1 month, which was not reduced by hormonal methods like progestins, and also tranexamic acid also was given, which is not reducing the bleeding. Now we are seeing that slowly we are able to see the scissor near the origin of the pedicle. So first we try to cut that blood clots to get the proper vision, and then so that is a blood clot, we just cut that so that it will come out, and then we are trying to cut the pedicle close to the uterine wall by using hysteroscopic scissors. So nearly 0.5 centimeter of pedicle size was present. So you can see that that is the pedicle close to the uterine wall. 2 or 3 snips were sufficient to divide the pedicle, and it is hysteroscopic guided. So we are having a proper vision. So one half is divided. I think nearly 3 millimeter of pedicle is divided now. Another 2 or 3 millimeter pedicle is still remaining attached to the anterior wall of the uterus. So now that is the final bit, that is we are separating it. So once we divide the pedicle, the polyp was seen still inside the uterine cavity, inside the cervical canal. Now we use the ohm forceps to take out the specimen. After taking out the specimen, we just had a confirmation check examination. So that is a complete. Still few more fibers are left. Yes. So this completes the polypectomy. Okay. So we can see it is in the anterior wall of the uterus, just inside the internal os. So few more fibers we are snipping it off just to prevent the recurrence. That is the uterine cavity once again. So now specimen is still present inside the cervical canal. It is little quite big. It appeared like a 2 into 3 centimeter mass inside the cervical canal. So after removing the specimen by using ohm forceps, now we are having a confirmation check examination just to confirm that uterine cavity is completely divided off. In the post-operative, this patient was uneventful. Suddenly she stopped bleeding and she was discharged on the same day. So this is the mass that was removed. Thanks for watching.